Spinal cord stimulation can be effective in reducing pain in up to 70% of patients with failed back surgery syndrome. The pain that typically improves the most is leg pain, but with some of the newer electrode types and programming devices, we're seeing better results with lower back pain as well. There have been a number of published studies which support the use of spinal cord stimulation in failed back surgery syndrome. These studies have shown that in the absence of instability or a recurrent disc prolapse, spinal cord stimulation is more effective than reoperating with more traditional surgical techniques. By undergoing a trial of spinal cord stimulation, you should get a fairly early idea of whether or not this therapy is likely to help with your failed back surgery syndrome. The assessment and treatment of failed back surgery syndrome is fairly complex and should be undertaken by a specialist with expertise in spinal surgery as well as neuromodulation. There are a number of treatment options that are available, and it's important to select the right one. With spinal cord stimulation, we do have an opportunity to help many patients with failed back surgery syndrome who couldn't be helped in the past. At Precision Spine and Pain Clinic, our team includes neurosurgeons, spinal surgeons and pain specialists, amongst others. We have a great deal of experience and expertise in the assessment and treatment of failed back surgery syndrome. If you've had previous spinal surgery and still suffer significant pain, you shouldn't suffer in silence. Ask your GP for a referral to a clinic which specialises in spinal cord stimulation and other modern strategies to treat failed back surgery syndrome. Have a look on the internet, get as much information as you can, and bring a list of questions to your appointment so that we can help you as best we can. Spinal cord stimulation offers a chance for people to control their pain with greater ease and improve their quality of life. Before heading down that path, it's important that this is coordinated in a team environment. We call this a multidisciplinary environment. Because of its nature, chronic pain requires a long-term strategy, and spinal cord stimulation is just that. In order to maximise your chance of getting a good long-term result and minimise problems or complications, you really need to have a solid team of experts surrounding you. At Precision Spine and Pain Clinic, we've assembled a team of experts in a multidisciplinary environment. These include pain specialists, neurosurgeons, psychologists, physiotherapists, musculoskeletal physicians, and others. By working together and thoroughly assessing and evaluating your particular case, we believe that this offers you the best chance of a good outcome. It's very important that patients are selected appropriately for this type of treatment. Even though it is a very low-risk surgical technique, it won't necessarily help everyone. In order to make sure that someone who is undergoing this procedure has the best chance of getting a benefit, they really need to go through a multidisciplinary workup. This involves assessment by pain specialists, psychologists, physiotherapists, surgeons, and a number of other specialists in order to not only make sure that the person is right for this procedure, but to maximise their chance of getting a good outcome and minimise their chance of having complications.